Hi, I'm Laura. Let's take a look at whether young people can develop early stage cardiovascular illness. Cardiovascular disease, or CVD, is a top killer of adults, but we hear a lot in the media about advanced stages of the disease. But what do we understand about all those decades of a patient's life before they show up in the hospital with a serious illness? The answer may surprise you. Early precursors to clinical CVD can show up at a surprisingly young age. I'm going to share an overview of what I found in the literature on this topic. So those of us who are young or have people we care about who are young can think a bit more about how to minimize our risk for chronic illness later on. First, let's disambiguate the term cardiovascular illness. According to the Australian Heart Foundation, cardiovascular disease, or CVD, is an umbrella term that includes all the diseases affecting your heart and blood vessels. CVD includes a major one, coronary heart disease, but also things like stroke, congenital conditions, and others. Today, we'll focus on coronary heart disease, which is specifically when atherosclerosis or plaque buildup narrows the coronary blood vessels and limits blood flow to the heart itself. There's a really interesting bit of history around the evidence of early stage CVD in young people. Autopsies conducted on soldiers killed in the Korean War with an average age of just 22 revealed that over 70% had some amount of atherosclerosis in their coronary arteries. Similarly, a study of 105 Vietnam fatalities found that half of them had atherosclerosis, and it was severe in 5%. I'm guessing a lot of these guys probably appeared to be very healthy while alive. So we've known for a while this can show up in young people, and the research to understand the disease progression has been ongoing. So how does this happen? This natural history diagram illustrates what the disease process can look like. Atherosclerosis can start at a young age and not manifest in a clinical way until much later in life. And cohort studies have confirmed that certain childhood risk factors do predict a preclinical and clinical CVD later in life. Some of the non-modifiable risk factors include familial or genetic hypercholesterolemia, which is high LDL cholesterol, and genetic drivers of things like obesity and hypertension. And as you would expect, the modifiable risk factors include things like physical activity, unhealthy diets, exposure to secondhand smoke, and obesity to the extent that it's modifiable. The genetic cholesterol risk, the LDL one, is a key one that's easy to diagnose, but is, quote, vastly underdiagnosed, according to one recent review when they're talking about children. But other studies say that broadly there is a challenge to properly screen the general population of young folks to catch more of these risk factors and intervene in a more preventive way. When early stage CVD is identified, in some cases, drug treatments like statins have been used successfully, but generally lifestyle modifications are kind of the primary treatment that we have today. So prevention, early diagnosis are so impactful for this disease to reduce the cumulative effects of all those risk factors over time. So how can we do this? We still need more systematic ways to assess risk in the young, the apparently healthy. And scientists are calling for better coordination between primary care providers of both children and their parents to put those factors together, public health and policymakers, and pediatric cardiology experts. And given the prevalence and cost of CVD to our society, I agree this is completely warranted. For example, there are epidemiological approaches that make recommendations for physical activity by life stage. This kind of science should be an input to public health systems that can reduce the modifiable risk factors. And there are some policy and school system no-brainers that we should all push for, like giving kids good nutrition, lots of time and space to run around and play, and healthy, safe environments. In closing, many may not realize how early the signs of CVD can appear, and we owe it to our children to focus more on prevention and early stage understanding. I'm glad to see research progressing in this area. Thanks for listening, and here are my references.